Hi, I'm Amanda,
I'm Sierra.
and we're occupational therapist students at FGCU. Thank you for interviewing with us for Assistive Technology class. If you want to just go ahead and introduce yourself and what you do, that'd be awesome.
Okay. Well, my name is Katie Biddison. I'm an assistant prosthetist and orthotist at Gainesville Prosthetics, and I've been working in the field for just over 2 years now.
What is a normal day like for you?
On a typical normal day, we see anywhere from about 5 to 10 patients, and both orthotics and prosthetics. And then we basically just go through the whole process of initial evaluation to definitive fitting to follow-up appointments. And they usually last about an hour for prosthetic patients. On your diagnostic fitting, it'll probably be about a 2.5 to 3 hour appointment. But aside from that, we just see the patients, take notes, do that kind of thing.
So what is the process of making a prosthetics like?
So the process of a prosthetic patient is essentially they'll come in, I would say, about 3 weeks after their amputation. We'll see them in office, evaluate their wound, fit them for a shrinker, which is very similar to what a diabetic patient would wear, like a compression sock kind of thing. We'll teach them how to wear that, how to evaluate everything that's going on, making sure that they're perfectly ready and prepared, how to massage their leg, that kind of stuff, for the prosthetic whole process. And then from there, they'll come in, depending on how much longer it's going to take for them to heal, for their casting appointment. We'll have a liner there for them that's also fitted to their limb, and then we will cast them with either fiberglass material, like if you had a broken limb, kind of a cast, or we sometimes use plaster casting as well, which is kind of throwback to the old days. But that just kind of helps you form and fit a little bit better than a fiberglass cast. It gets harder faster. And then from there, we'll take that cast, bring it into the lab in the back, and pour it up with a plaster mold. That'll harden up, and then we do all of our modifications to form it into a socket. And then once that's modified, we take it and pull a plastic over top. It's called Durplex. And that uses like a vacuum system, and it pulls down over top of the limb. And then we will have the patient come in again for a diagnostic fitting, which is about a week after their casting appointment. At the diagnostic fitting appointment, they will try on the socket, make sure that it fits well. Once that process is like they're happy with the fit, everything fits well, they don't have any areas of like high pressure or any bone issues, we will mount it to a green plate, which is how we mount the foot to the socket. And then they will walk on that for a little bit, and then they'll come in and we'll finalize the socket. We'll send it off to central fabrication, and they will laminate there just because the chemicals are too much for us to have just in our daily. And once that's happened, they'll come in for follow-up appointments, and we'll just keep tabs on them, making sure that everything feels good. They're not having any areas of high pressure. They're not having any redness on their limb. It's not too tight, that kind of stuff. And they can manage all of that with socks. We teach them how to use those as well.
Cool.
So what are your typical clientele?
Our typical clientele, I would say, ranges all ages. I have pediatric patients. I have older patients. We do see veterans as well, but not as many as people would think. I would say a lot of those cases are either handled in the VA hospitals themselves, but some still are seen outside of the VA. And then from there, prosthetics specifically, we see a lot of patients who are diabetic. And all the way from like partial foot amputations to above knee, because it kind of progresses over time. They'll lose they'll lose a toe, and then they lose part of their foot, and then they lose it at the ankle, and then they lose it transtibial. Like it just kind of climbs. And so we teach them kind of how to take better care of themselves, make sure they're getting good blood flow. If they get wounds, we're like super on top of that, because if they get an open wound in the socket and
typically reimbursed?
So typically we're reimbursed for prosthetics based off of a K level, and that ranges from K1 to K4. K1 being just a normal person who would transfer from the bed to their chair, transfer from their chair to the bathroom, that kind of thing. K2 being slightly more active than that. K3 being able to walk on uneven terrain, more active in the community, spends most of the time on their leg. K4, basically what you would see as like an Olympic athlete, like someone who likes to run marathons, is constantly running, needs the foot of a higher level to be able to run. Just because if you think about it, a foot is like a carbon fiber material, so it's harder to produce spring if it's more sturdy versus not. And so that is reimbursed differently. And then we kind of submit that paperwork to the insurance companies, and they fund us based off of that. So we have to like receive authorization just as any other type of medical care that you would receive. And then we have our front desk staff kind of works with that. And then they approve it, and then we move forward with making the leg. And then typically we're reimbursed fully for that, so that's not an issue. But recently in the news, there's been an issue with Medicare, and they are proposing essentially prosthetic care to be that of the 1970s. And so there's been a huge uproar in the amputee community, and there's been a bunch of meetings and that kind of stuff. So hopefully it doesn't get passed, but if it does, our field is going to be greatly affected.
So what are the educational requirements?
For someone in our field to become a licensed practitioner in prosthetics or orthotics or both, so you would be an LP, an LO, or an LPO, you now have to have a bachelor's, and that can be kind of in anything. There's a lot of people who do like engineering degrees, any type of like pre-health kind of stuff. You have to take like physics and also anatomy and physiology. And then you apply to a master's program. Your master's program will be for prosthetics and orthotics. It's titled differently at a whole bunch of different schools. But you go to that. That's a 3-year program. And then once you graduate from that, you'll start your residencies. You do a year residency in prosthetics, and then you take your boards, and then you do a year residency in orthotics, and then you take your orthotics boards. If you choose just to do one or the other, then your time is obviously cut shorter. You can only just do a prosthetics or only just do an orthotics, and then you only are another year out. But similar to like med school, you get paid during your prosthetic residency, but not as much. Once you take your boards and pass them, you're then licensed by the state if your state requires a license. And then overall, you're certified through our certifying agency, which is called ABC. And then there's also one that's called BOC. But typically, most are aiming for the ABC just because it has a better, I guess, like name overall. People hold that to a higher standard. And then from there, you're free to work and get hired anywhere you want. And then from there, you can also qualify to get a fellowship once you've been working. I think it's 5 years, but don't quote me on that, I guess. And then you can become an FAAOP. But that's only for practitioners who are licensed in prosthetics and orthotics.